I get some questions on BPC-157 from time to time. This is a peptide that can be used for musculoskeletal injuries and pain to help provide increased recovery and help with the nagging pain. It is a peptide. Peptides are branched-chain amino acids. This one is specifically a 15 amino acid sequence, so sometimes it's called a pentadecapeptide. It seems to improve blood flow to these areas. Ligaments and tendons are notoriously hard to heal and can sometimes have more chronic pain because of the poor blood flow. And so BPC can be utilized to improve blood flow to these areas, to get the growth factors, the healing factors in there to help start the process of healing and repair much faster and more effectively. The problem is that we do not have long-term human studies to show long-term safety outcomes with this peptide. It seems awesome and has even been, I've seen it marketed as the Wolverine peptide. I would not expect human Wolverine type results with every patient, but I have used, and anecdotally, I've had good outcomes in guys that have failed formal physical therapy, steroid injections, and continue to have these nagging pains. So at times it can be brought in as an adjunct to physical therapy and everything, depending on what the pain is specifically and what is trying to be treated. I have not seen it have good results in neuropathy type pain, so the burning and shooting like sciatica down your leg or shooting down your arm. I have not seen it have good results with that. However, elbow, shoulder pain that just won't seem to go away, it has been used with good results. Does seem to have minimal side effects. However, like I said, we don't have just long-term studies to show long-term safety. It seems to, like I said, improve blood flow to these blood poor areas. The theoretical risk factor is that if you had a tumor or a cancer that you're improving blood flow to, it would make it more aggressive. That has not been depicted in even the rat studies. We do have a lot of rat studies showing its safety, and it seems pretty awesome as they have severed the Achilles tendon of these rats and utilized it, and it helped regrow the Achilles tendon. And not only did it regrow, it was now more architecturally sound with increased fibroblast deposition and growth hormone receptor sites. And so it seemed to be even more architectural, more structural after BPC than prior to being severed. So it is a viable peptide that can be used for chronic pain or even acute injuries. Can be administered subcutaneously, so an injection into the fatty tissue. It can be taken orally, and it does seem to have even GI benefits. It is made from human gastric juice, so it seems to be stable in that environment even when taken orally, and it does seem to improve leaky gut, peptic ulcer disease. Sometimes it can help with irritable bowel syndrome, and they are trying to use it in like ulcerative colitis and Crohn's and the more severe GI diseases. And so I do hope to see more research studies out, and so hopefully the FDA will remove it from the do not compound list. But right now the FDA recommends against it just due to the lack of long-term human safety studies.